All right, everybody, welcome back from lunch. Well, the little break, we had our lunch earlier. Hope everybody's doing well. Thanks for that robust discussion that we had. Now we have the second part of three that I was kind of teasing, where Keiko, Charlie, and I got a chance to sort of reprise some of the ideas that we did at the side event that Keiko organized in June at the Conference of States Parties with a little bit more time. So we get a chance to really expand on our ideas. Keiko is a friend and colleague of mine. She's based in Canada at McGill University. She's an associate professor, and she is the Canada Research Chair in Childhood Disabilities. She's done an enormous amount of work related to technology. She's an app developer. She's done work on leisure and recreation. And when we wrote to Keiko, we said, just talk about whatever you want to talk about. So it's up to Keiko to share whatever she would like. So Keiko, you take it away.
Thank you, Derek, for the invitation. It's a pleasure to be here talking to you all today. I really wish I were there in person. That would be much better, but didn't work this time. But we're planning to make this happen soon, hopefully. It has been a very fun experience working in different collaborations with Derek since the first COSP that we went to. When we first met, I don't know even how many years ago that was, but we have done a lot of projects in collaboration since, and many of them related to the CRPD, most of them. And I was listening to your talk, Derek, before, and I was like, oh, maybe I don't have anything else left to talk about. So because I can't talk about anything, hopefully we'll have good conversations. I will skip the parts that might be repetitive from what Derek already said, but hopefully we'll try to engage in conversation. I know conversations on Zoom are never as fluid as we would in person, but hopefully we'll have time for some good conversations and exchange. So my pleasure to be here. I'm speaking from Montreal, where it's finally summer arrived. It took the whole summer for summer to arrive here, but it's really nice and warm this week. But I am, as Derek mentioned, based at McGill University. I'm an occupational therapist by training, and a lot of my interest in research started from the idea of adaptive sports and leisure. How I decided to become an occupational therapist was first a bit of a personal tale. I volunteered when I was in high school. I volunteered in Brazil. I'm from Brazil originally. And I volunteered to Special Olympics, regional Special Olympics. And I fell in love with the idea of sports and activities where everybody really could play and where people were included. At the Special Olympics, I was fascinated by how hard people were trying and how much people were supporting each other, and people with all types of disabilities and ability levels were allowed to play and have the sense of accomplishment, to have a sense of belonging. And that's what moved me to become an occupational therapist, and then later on to move to Canada and do research in this area. So I'll try to give you a quick overview of where this is. Derek said I can speak anything. So my research program is a lot around this idea of rights. And Derek spoke a lot about the Convention on the Rights of Persons with Disability, the CRPD, and I do a lot also transitioning in the space of the Convention on the Rights of Children. And that's where I'm going to anchor my talking points today. So the idea that we all have rights, I think, is something that resonates. And I'm sure if you're all there on a Saturday, on a symposium, for sure, you don't need to be convinced that people with different abilities, of different ages, of different cultural backgrounds, no matter how they are or what they are, they have certain human rights. And for some populations, this has to be protected more than for others, unfortunately. But fortunately, we do have instruments and tools and resources that make this possible. So my research evolves a lot around this idea of promoting health. So I am, my department is located within the Faculty of Medicine and Health Sciences. And here in the health sciences field, it's still very kind of foreign. The idea of human rights is not a common conversation. So when I first came into faculty, it was a bit of a hard sell to sell my research program around human rights promotion in the Faculty of Medicine and Health Sciences. And slowly in the last 12 years, I feel that there has been an opening and understanding that the only way that we can do research that is relevant for people is if we, one, make good partnerships with community organizations, with communities in general, and we listen to people that are living with the issue or with the lived experiences. And then three, that we do this communication process ongoing. So do research with people and not for people, and promote leisure in a broader understanding, promote health, sorry, in a broader understanding of promoting rights. So that's what I'm trying to implement in all my research projects and partnerships. I love this scheme, and you have the link there. Not done by me, but done by another group of partners, the Arch Disability Law Center, but just drawing on the convention that Derek spoke in great extent in his talk. So I won't take too much time, but I like the visuals that are easy and accessible for people and that are fun and show the different articles of the convention and how they reflect or how they can be the text of the more dense part of it. That's what you can find through the UN website. But I'm going to focus the talk today in some of these aspects, mainly the respect for evolving capacities of children with disabilities and the right to preserve their identity. So that's Article 7. Also talk a little bit about respect for home and family, highest attainable standards of health without discrimination, and participation in culture, recreation, leisure, and sport, which I heard Derek spoke a lot. I do not have an adaptive sailing program in mind. I would love to know that, but have other adaptive leisure opportunities that we've been developing here in Canada. And that's what we're going to talk about today. So this idea of living independently and being included in community, and that's the main emphasis, I think, for me, it's the overarching article that taps pretty much into everything. Is the idea that when we think of communities and living in urban centers, as most of us do, and in nuclear families often, right? So we are losing, historically, we're losing the sense of community and belonging to a community as part of something where everybody's responsible for everybody, where people are accountable for what others are doing, but also how others are treating the group of people who are most vulnerable. In this case, my research focuses a lot on children with disabilities, but we can also consider other groups of marginalized or equity-deserving groups, such as the elderly, such as other persons with other types of disabilities, mental health, homelessness situation. So there's so many groups in our communities that we don't think as being part of our community just because they have differences, right? And when we cannot understand what is the lived experience of these people, we don't have to think, right? Far from, what is it in English? I always forget the expression, far from sight, far from mind. Is it far from heart? But if we're not living with this specific situation, unless we have a child, a cousin, a parent or someone in a specific situation, it's often much, much harder to understand what are the challenges that people are facing, and to understand that it is our responsibility to include those people in the community living, in the everyday life of communities. So with that in mind, is how I think that's what's important to bring the conventions to the site or to the public more and more, so that we all understand that people are protected for a reason. People have specific articles that we give attention for a reason. And the reason is that otherwise we would just go on and forget to include them in the everyday activities of communities that should be good for everyone, right? So with this, so the Convention on the Rights of the Child has more articles. It's an older instrument. So the Convention on the Rights of Persons with Disabilities is one of the newest instruments of the UN, whereas the Convention on the Rights of the Child is the oldest one. So it's very different in types of language, and you can see how the UN has evolved in promoting and understanding the development of rights. But it has some articles that are common and that are talk about the same issues that we see in the CRPD. So non-discrimination, I would just highlight a few. Article 4, making rights real. So that speaks to what Derek spoke on, how countries implement the convention on the daily policies, on the regulations, on standards, on programs and services offered. So making rights real, so that those rights are not a simple pretty text or something that is too high to achieve, but actually that is translated into services, programs, conversations in everyday life. In the Convention on the Rights of the Child, there is a specific article for children with disabilities. That's Article 23. And then other articles that are easier to recognize on the importance for children, such as health, water, food, environment, and rest, play, culture, and arts. So play, a few things to highlight. Across those two instruments, we know that, one, we cannot discriminate against any other aspect that are part of the identity of this person, be it a child, be an adult with a disability. We cannot discriminate based on age or based on the condition that they present. We have to work or to take concrete action towards implementing those instruments, otherwise they have no value. We have, even within those groups, we have special protections for children. So across both conventions, children with disabilities are the only group that is double protected. So they have a special article on the Convention on the Rights of Children. They have a special article on the Convention on the Rights of Persons with Disabilities. So they really need a lot of protection. And aspects such as health and community inclusion and play and leisure, they are important throughout. So we cannot neglect even if we want. So thinking of inclusive communities or ways that we can build or conceive, develop communities that are inclusive for all, we have a few actions that we are developing here in Canada, and that I want to share with you, and then hopefully we'll have good conversations. And I love establishing parallels between Canada and the States, but it will be good to have those conversations afterwards. So here in Canada, there's a new legislation. We don't have an equivalent of the Americans with Disabilities Act here in Canada, but since 2019, we have, for the first time, a disability-specific legislation that is called the Accessible Canada Act. So through this act, there is a series of federally legislated areas that are being implemented, and in a course of 20 years, there are some specific indicators and markers. Personally, my research group, we have been working on developing and helping in the development of meaningful consultations. So we did a project with government to how to consult with the population of persons with disabilities and the civil society organizations and the organizations of persons with disabilities to help them provide really meaningful input into the development and implementation of this legislation. Then we are now doing a few projects looking, one, into accessible customer services. So we are doing a thorough research review, and I have a group of students into what we need to pay attention to in terms of customer services for everything in terms of accessibility. We're also developing a new standard for youth employment. So for youth with disabilities, what in the communities we need to create and foster so that they can transition from education settings to work and employment. and in the community. And we also have a few projects looking specifically into accessible communities, as we understand, broadly defined as public spaces.
Sorry.
Is it okay? We're back? Okay. There was an echo. Public spaces, playgrounds, and considering aspects in the different sectors that are the most important and relevant for children, like school, health environments, and play environments. So for this, in this project, we developed the Child Community Health Inclusion Index. My student, Paul Yu, he spent his PhD to develop this. So the CHI is an instrument that was developed in the States. I think he's based in Chicago, I forgot now. Or is it New York? Sorry. In the States by a colleague, Yoshai Eisenberg, and he developed the Community Health Inclusion Index, which was an index made to help programs. So programs like if you are developing a new sailing program, or if you're developing a new soccer program, or if you are a city and you want to implement a strategic plan for inclusion, for accessibility, the Child Health Community Index, the Community Health Inclusion Index was supposed to help with that. And what we noticed is that it's an incredible index, but it was missing an attention to children. So we proposed to develop that, and that's how we came about the Child Community Health Inclusion Index. It looks broadly into 3 levels, so across sectors, what you see in the first line. So we look into education, health, so hospitals, clinics, any health establishments, public spaces like parks and playgrounds, and community and institution organizations like community center, libraries. And what it provides is a very broad assessment of the inclusion and accessibility of those venues. So both at the venue level, so at the physical accessibility, so looking not only how the buildings are made, but also how the access to the buildings can happen, and if it's accessible and safe for children. So thinking of public transit routes, active transportation options, and safety signing and all of that. And at the third level is the inclusion domain. So looks, as I said, in the built environment and equipment, but also into the programs and services, the staff practices, and the policies. So the macro level, what are the policies that exist that support this program, either through funding or capacity building, or local policies that support or hinder inclusion and accessibility in those different spaces. So the article is there, it's all open access, you can check. We developed this based on the Community Health Inclusion Index, but then we added to it indicators from the UN CRPD. We also added indicators from the CRC, and some other, the WHO Urban Health Agenda, and some other international frameworks, to make sure that the index is as comprehensive as possible and can help people who are trying to develop inclusive programs. So happy to talk more about that and provide you the full questionnaire for anyone who might be interested in using it. This is in one of the sectors that we're trying to facilitate communication with communities, with cities, with provinces, states in the States, but to make sure that we build and that we decrease this gap, right, between how communities are done and set up and how they should be. So nearly the numbers from UNICEF, from the most recent data report on children with disabilities in the world, showed us that 1 in 10 of all children worldwide have a disability. The numbers are that maybe less frequent in developing countries or high income countries, but overall we know that there is a lot of children with a lot of needs who should be able to participate in any program, who should decide on a sunny Saturday morning that they want to go sail, and then there is a program that would be ready to to have them participating, or that they want to go play soccer and that's easy to go, or that they want to swim, or whatever their dream or wish might be, that they can do that. They can play in a playground, and that playground will be accessible and welcoming for them. So the previous special rapporteur for the CRPD, Catalina Aguilar, said that this is a legacy of the model which has caused exclusion and marginalization. The fact that children with disabilities are among the most likely to be left behind. So of all groups of marginalized, vulnerable groups, children with disabilities are often left behind. We can no longer have children being hidden away and isolated. Children with disabilities must have the opportunity to dream of a full and happy life. And I think we often, when we see illustrations like from the UNICEF, it's often from other countries or from developing or low and middle income countries. But it saddens me to think that it is still the reality in high income countries such as Canada and the States, that children want to go and play in the playground, in the neighborhood playground, and this playground might not have an accessible path for them to get into if they're using a wheelchair. Or that they might be autistic, and they will arrive into the park and other kids will not know, or other adults would not know how to be welcome to them. So those are challenges that we can only solve when we think of building communities, and not when thinking of isolated actions, right? So when we think at macro level, what can we do to help those children participate? So somewhere a child is being told he cannot play because he cannot walk. And the right to play, for me, it encompasses the bulk of childhood. As an occupational therapist, a pediatric occupational therapist, I practiced in Brazil for a few years before I moved to Canada. And I know that the reality of child development, the most important activity that a child can do is play, and both free and structured play. And that is not the reality for children with all sorts of disabilities. So some of my previous research would have looked into the determinants of participation in leisure for children with disabilities. And what we saw is that so children with disabilities, when compared to same age peers, they participate less in physical activity, they participate less also in social activities, they have less friends, and especially less reliable friends, so friends that they can count on or that would invite them to play. There are a few social network studies, analysis studies, that ask, like, who are you, who do you have lunch with, or who do you talk to during recess? And children with disabilities, even in inclusive educational systems, they are rarely mentioned as the friend who is invited for lunch, or who is invited to play together during recess. In one of the studies we did here in Canada, in Quebec particularly, we asked what type of activities that children, adolescents, that was for adolescents with disabilities, and the type of activity that they wanted to do the most, but that they rarely had the opportunity to do, was to be invited to birthday parties at friends' house and sleepovers. And that's a big part. I don't know how many of you have adolescent children. I do have two. And I know for a fact that being invited for a friend's birthday or for a sleepover at a friend's is as important as going to school, if not more, right, for their well-being. And in this study, like, I remember, like, I had my heart broken in this interview when parents said consistently or over and over, my child just wants to be invited for parties, and they're not. So having strong social contacts. And another limitation is financial means to do a lot of the adaptive sports or activities that require special equipment and costs. But in a different study, we saw that actually cost is not the biggest barrier. Most of the barriers are social, and therefore most of the barriers are related to things that we can address if we build awareness, if we raise communities that think differently. On the other hand, children and adolescents with disabilities, they engage in way more passive activities. So when we are accounting for leisure time, children spend much more time on screen. I know that that's a reality again for all children this day and age, but for children with disability, they spend way more time in sedentary passive activities. They do more activities that are segregated than integrated, and they have more mental health complications and also more cardiovascular and health diseases over time, much due to a cycle of deconditioning that often starts with, I cannot play in the playground, I cannot go in the regular sports team in my neighborhood, I become a passive, a non-active child that becomes a non-active adolescent, and that has consequences for their health throughout their entire life. In another study we did also here in Canada, we saw, and that was exclusive for adolescents with cerebral palsy, but when we saw access to community, when we asked some of the barriers, we saw that the children who have the most physical limitations, so those at the GMFSS, that's the Gross Motor Function Classification System. So the children who were unable to walk, they were the ones who faced more barriers in the community. And the access to leisure facilities in the community was the item that parent responded. Parents said that was the item that they want most and they have the least access to. So the question was, if you could choose one thing that you really want to change in your environment, what would that be? And they said it would be access to community leisure facilities for their child. And that, again, especially if their child had a significant physical limitation. A lot of this inclusion translates for me in this poem. So this was another study we did asking adolescents also, what were their perspectives on their rights? So the question, we did a series of photo voice. There was a photo voice study that we asked them to identify or to take pictures of their daily life and what in their daily life were barriers. And how their human rights, and then we had a workshop showing them what are the conventions on the rights of the child, what are the conventions on the right of persons with disabilities and what they mean. And then we asked them to take pictures of their daily life, translating how they see these conventions happening or not happening in their daily lives. And we presented that in what we call the policy dialogue. So we brought together representatives of provincial governments from all 10 provinces and territories in Canada, and federal government, the Office for Disability Issues, so key policymakers in disability rights. We presented the findings of this, along with the findings of other research looking to rights-based approaches. What we saw on the photo voice part of the study was not surprising, but it was so concrete and real and really made into words and images how rights are not perceived on their daily lives. All they could tell was barriers, right, to their rights. So there was not one single positive, let's say, the positive application of rights, and they had several examples of how their rights were not respected in their daily lives. Some of it was translated by Nico in this poem. So I said, I get frustrated in my wheelchair when I can't get everywhere. When an elevator is out of commission, it spoils my shopping mission. I sometimes need my Uncle Mike to get me into a store. He lifts my wheelchair up so I can shop some more. I get frustrated in my wheelchair when I can't get everywhere. And Nico is this one in the wheelchair. So he asked his mom, Joanne, to take the picture. But he wanted to convey the poem. And he said, you really have to tell people that we cannot go places. And Nico also used the alternative communication so he preferred to write a poem, was his response to our questions. And I think this translates well the desires of any adolescent. The title to the paper that we did from this was, I'm a normal kid, I just happen to have a disability. So it's not different than any other child who wants to go shop or who wants to go somewhere with their family or with their friends and they can't. So based on that, on a series of other studies, is that how we created the Jouer app. So we did a series of forums in Canada, had over 200 people participating in a priority setting activity, where we asked, we know that there are several barriers in the environment for participation in leisure, but if we could create one, if we could address one priority, what would that be? And across the different forums, the priority came down to create a list of adaptive leisure resources and opportunities. And mainly because they said, we don't know. Parents would say that consistently. They're like, we really want to have activities, but we don't know where to go. And requires, it's like a detective work to try to find if an activity is inclusive, if it's inclusive or adaptive, is it for my child? Or is it not good for my child based on their needs? So then we have to go and figure out, and sometimes the information is not clear. So the Jouer app was created with that goal in mind. That's where Derek very generously said that I'm an app creator. I'm a creator, but I'm definitely not a developer. I am very technology impaired. But we had a fantastic group of developers and UX designers, and that did that back in 2015. So now the app is 8 years old, and it's a very hard thing to manage. I have students updating the database manually. I'm still to figure out some better way to do it. But the challenges that we face to put information out for families just shows a little bit how hard it is for families to find information when they're looking for it. So the Jouer app now has nearly 5,000 users in Canada only. We expanded to Australia last year. It proved, not in 2021, and it proved to be way more complicated than we thought. I'll throw it out there. Every time I talk about Jouer in the States, someone comes talk to me, oh, we have to do this in the States. We really do. So that's the idea is there. If anyone if anyone has a technology or app development mind and wants to talk, I'll be happy to expand. We have some activities listed in the States because people added. If you send activities, I'll be happy to add to our database. But in practical terms, currently it works in Canada and Australia, not all parts of Australia. But it's a free app, so you can download. Please do download. And if you do want to interact and to bring it to the States, we can talk. But it has, so it's on Apple Store and Google Play. Essentially, is divided into arts, camps, and sports, and others. So divided by proximity. So in a map, it's GPS location based, and you can find activities according to their rating and according to the comments that people leave. And also through location, so closest to where you are, because that was another big complaint we heard from families, was that we wish we could find activities that were close and not like 2 cities away, and that is not practical for our child to engage. So we try to address a lot of those problems by creating this list of resources. The activities are not verified, but we have students verifying the accuracy of the information. But users can suggest activities. So we have over 4,000 activities listed in Canada. During COVID, we also listed online activities that were accessible, and some of they remain. So you have the option to join in online activities. And it's an app. In others here, we have activities like adaptive movie, cinema sessions, or playgrounds that are specifically inclusive, and any other like friendship circle. I don't know if you have that in the States, I guess you do, but other resources and supports, respite care that might be available for families. So any other information that might help and support leisure and community participation. So that's how we classify and create Jouer. Now moving on into health, so the right to health. We know that in Canada and I was going to check the numbers for the States, but I thought it was better not. So I'll leave you to that. But Canada is ranking historically, Canada, being a high-income country, still ranks in the middle for child well-being, and that's consistent. So UNICEF does this report cards on child well-being every year, and not every year, but with a certain frequency. And Canada has historically ranked in the middle among the high-income countries, and that's always a shame. But it's good to understand why also Canadian children are among the unhappiest ones. And so health, the right to health may be compromised if you cannot feel happy, right? And we know that participation in community is a big determinant of well-being and quality of life for children in general, for people too, for adults too, but more so for children. So if health means feeling happy, we know we are not doing well by our children, and that's for all children, not necessarily only children with disabilities. And this is according to some of the indicators that are very similar, and that's why I tried to bring this parallel. So it's access to education, access to fresh food, to breakfast before school, for active transportation or alternative transportation means, vaccines and important essential drugs, and physical activity. So all of those indicators, we're not doing well in comparison to other countries in Canada. And also we know that children with disabilities are doing even worse. So in Canada, and that's old data, but the types of disabilities that we have most in children are chronic conditions. So children will grow up with these conditions. And that impacts family well-being as well. So we know that, again, thinking of communities, it's not only about the child, but the fact that most parents of a child with a disability will have to work fewer hours to take care of their child, or they might change the working hours to accommodate for their child's needs. Or one of the parents will choose not to take a job, or they will have to quit paid employment to work full-time as a caregiver, non-paid caregiver, or turning down promotions or better job opportunities. So we know that childhood disability has an important impact on health, and all of that goes against the convention articles on health. So health depends on families and support systems, again, communities. So during COVID, everything got exacerbated. We all know, we all experienced that, and we are slowly coming out of it, but we know that the consequences for vulnerable children and for children with disabilities are likely not to be back to normal so soon. So we know that in Canada, again, this is a higher proportion of parents of children with disabilities were extremely concerned about their screen time of their child, the loneliness, isolation. That was a survey taken during COVID. But also all the concerns that all parents had for all children, and even for us adults, they were much exacerbated in children with disabilities. So both for general physical health, mental health, loneliness, academic opportunity to socialize were all limited, and eating junk food or sweets. So all the essential indicators of health were compromised way more for children with disabilities. So having access to services and supports really is what health translates to. And those rights are not being fully accomplished in many ways. If we talk about the rights to non-discrimination in Canada, as Derek mentioned in his talk, so Canada is a signatory of the CRPD and the CRC, and as such, we report every 4 years for 5 years. So Canada has had 2 report cycles for the CRPD and 6 report cycles for the CRC. In the first report for the CRPD, which was in 2016, there was incredible backlash from the UN saying that there was no data on children. So the report, as Derek mentioned, there is a government report and there's a shadow report that can be done by anyone. And the government report had absolutely no information on Article 7, so nothing on children. That generated a lot of, that's how I got brought into the UN reporting, and we went to Geneva and then to New York many times to support what's the data on children, but especially on the shadow report, that we could add some research data and also some community data to say how children with disabilities were not being attended by the convention through the convention implementation. And that generates something that it's called the concluding observation. So once the country goes and reports in Geneva, the UN committee will make recommendations that are called concluding observations. And this is the material for the country to follow through and to take those points and transform into policy programs and services. In Canada, the main point that we did, and I always tell this to my students, like my whole research career came down to having, like, we got to the UN in Geneva, and the International Disability Alliance, IDA, International Disability Alliance, they were organizing the Canadian Commission to speak, and they're like, okay, so you have 2 minutes per issue as civil society representatives. So you have 2 minutes to speak on the condition of children with disabilities in Canada. And that was the biggest condensation, summary power that I had to have on how to do 2 minutes to speak on the condition of children with disabilities in Canada. So that's a good lesson for students. I don't know if there are students or, but how we make our points very, very clear and concise. But the main point that we had for Canada is that we didn't have data on children with disabilities. There was very, very old survey data, nothing available in Statistics Canada. And then we could integrate with that the use of the Washington Group, the OHCHR indicators, the CRC indicators, and the SDGs indicators, all into this Canadian Wellbeing Framework. And that's a project that we're working now with the federal government to integrate more of those data collection measures, and in the next census this will be integrated, and that's a very happy outcome coming out of this reporting process. We also used, and that's a project done with Derek and many others, but on the text mining and technology, but we developed, Derek and I and some students, we spent a lot of time developing a model to integrate the articles of the CRPD into a dictionary, and to use that to assess how policies that were produced in different countries, but also in Canada with different separate studies, responded or had alignment with the articles, the different articles of the convention. And that's, again, a way that we can keep governments accountable, but we can also think and understand how policies and programs reflect this convention or not. A similar and less non-data mining, but similar thematic approach was done by a student of mine looking into policies on childhood disabilities in Nigeria. So comparing with the CRC and the CRPD, she looked into all the different reports, the shadow reports and the government reports from Nigeria for those two conventions. And we analyzed how that was reflected and how policies reflected implementation. We also heard Derek speak of youth advocacy, and then that's on Article 4 for the CRC, Making Rights Real. We have helped families and youth with disabilities to understand how rights apply to their daily lives. We brought a few parents and youth to the side events in all those last years, and bringing people together to speak, want to understand how those conventions can help them advocate for their child services, how, as youth with disabilities, how they can make the convention real and teach others and make this part of their communities and where they go. We created this infographic to help Canadian families understand the cycles of reporting and where their input can be heard and how they can provide feedback into the reporting process. Also went to Geneva with a parent and a youth on the reporting day for Canada, and that has helped spread the word from other families on how to engage in the process of the convention. So we're trying through different actions to understand. Now we just got a new grant here to understand how civil society led domestic monitoring of the convention happens. So we're looking to best practices and models across the world. And we're going to try to integrate that in Canada and engaging and training youth and family advocates to be part of the entire process. With the hope, so look at my time how long? You said I can talk all I want. I can speak for 10 hours, but I'll stop there. So this figure, again, I really wish I knew who drew this, because I've been using this so much. Even I am bored of that, but it's so good. I cannot help not using it. But I love the idea that we, even at the advanced level, we try to think of equality as something to promote. But if we give the same resources for everybody, some people will inevitably not benefit, right? Or not be able to participate. If we think of equity, so we give the adequate resources according to the need, we may have a better understanding and may allow for everybody to participate. However, reality is that some people are at too big disadvantage, that there's nothing we can do here, that there's no equity perspective that will allow, in reality, to make an accessible or a fair playing field. That the only way that we can really, really promote full participation and full inclusion and integration is through the idea of disability rights, where we remove the systemic barriers. So if we remove the fence, if we remove the policies that are non-inclusive, if we just don't make possible for barriers to exist through the way that we design and think of programs, that we design and think communities, then that's where we will have a real ability for everybody to participate. Happy to talk. Thank you so much. I am really sorry. I really wish you could have more conversations. I mean, I think we'll have some time for Q&A, but feel free to reach out. The Childhood Disability Link is a summary of research evidence on children. Child Bright is a patient-oriented network that we do a lot of the KT. I lead the knowledge translation program in this network. And the Jouer app, you're free to download and use, or maybe add programs and suggestions from the States. Thank you so very much. I forgot, I want to thank my team, because they are all a lot of people involved in all those projects, and also a lot of the funding and contributing partners. Thank you so much.
Fantastic. Keiko, thank you so much. You were just fantastic as usual, and you have lots of ideas for us to work on, and things that you're already doing. We're going to try something here. I have a handheld phone, well, a mobile phone, and I'm going to try to walk around to the questions and answers and give this to the people that have questions. We'll see if it works. So my plan is to turn off the audio here and then put the audio here, and hopefully it doesn't scream at us. So hold on one second. There's that. Maybe turn this off. Now there's that. No. Okay. What I think we're gonna do is
now I can.
Good.
Oh.
So if you speak loud, there are microphones all over. She should be able to hear you, but I'll let you do your video here. So what are your questions? Okay, wait.
Do I look here?
Yeah, look here and speak loudly.
Sounds good. All right. First of all, thank you so much for zooming in and talking to us. This was a really great presentation. And I wanted to ask, when you were starting the Jouer app and you were beginning all of that process, how did you begin to gather all the resources to centralize that list of disability resources?
Yeah, that's an excellent question. And it's one that I wish I had a better answer than the true. So the reality is we started with Quebec, right? So and we created a search strategy that included like keywords and Google. That's where I was like, I really wish I had a fancier way to have done that. If I had met Derek back then, maybe would have found a better way to do it. But so we created a search strategy on Google initially, and then we snowballed from there. So that had some keywords, right? Disability, children, inclusion, adaptive, adapted, and there we go with all the keywords and search. we had a list also of programs from the rehab centers. So a lot of the rehab centers, we contact all the rehab centers, and we started in Quebec, as I said, then I added one province per month slowly in a period of 2 years. That's how we grew from Quebec to the whole country, but it was all generated manually. So the rehab centers, most of the pediatric rehab centers had a list, and you was usually sitting in like an old PDF or Word file, some handwritten notes. It was very scattered, but we contact every center asking, do you have a list? Can you send to us whatever you have? And they sent, and from there we grew the strategy. And we did that for all provinces. And then every summer, I have a few summer students who update it all manually. And I'm saying that with sadness in my heart, because I know there are better ways to do that. We couldn't find a better way to do that yet with the budget we have, because the information is very different. It's hard to standardize. We tried some automatic ways to what is it called, to swipe to take data. Yeah, exactly. But it's never consistent, because people call this that, and so the language is very not consistent, that we could not figure out a way to do it automatically. So all manually. We now have a very good search strategy that we keep adding every summer, but it's really only summer. And the students check one by one, and they update on the back end. And the other thing, we have probably a third of the activities now have been suggested by users. So there's a bit of the organic, as people know more about the app, if they know about programs, they can suggest. So through the app, there is a suggest an activity, and they will suggest. You just need to send the link, and then we add the activities. But again, all manually. So that's why it's so hard to bring it anywhere else, because in the States, like I had someone in California who had tried, someone in New York, but you need to have someone really committed to create and maintain the information up to date. Hi.
All right, Keiko, we got Dr. Anderson here.
Hey, Keiko, thank you so much for your presentation and for being with us this afternoon. My question kind of jumps off of the last one, and I'm curious about plays or angles for entrepreneurship with this app. I think that there's a really large space for organizations to gather, customer acquisition through your app. So, and then like the vetting process through the community. So, like I know, at least in the States, we have arts and organizations. I'll just say like a local one, like Imagination Stage, that does sensory friendly performances. And so if they knew of your app, that they could be a spot on your app that families could have access to, I think I see a place for entrepreneurship there. To our previous, before your presentation, Derek was asking about the entrepreneurship angle, so I wanted to make those connections. But I was curious about whether your group had considered something like that.
Yeah, that's a great point, and we have. It's fun because I keep saying, when people ask anything about the Jouet app in those years, I've learned a whole new path on business technology development that I have absolutely no training on. But yes, so we have done, we got a fund from the federal government, I think in 2018, and we did that, the knowledge brokers, what we called, so to contact organizations and see if they wanted to be on the other, so help the app grow, but also maintain information even. What we found is, for the most part of organizations offering inclusive adaptive activities, the problem is a very, very small capacity. So they have a lot of the programs run like on a shoestring, right? So they really don't have more resources than to run the program. So we did a partnership, for example, even with the Canadian Paralympic Committee for a few years. And even they were trying to maintain the resources updated and having the programs like the pathways for athletes to become athletes. And everybody running programs, it seems the case, does not have space to even think of entrepreneurship, right? To think, okay, how can we improve that? Or even we had the case, very few, but we had a few organizations that contacted us, because when we add an organization, we send them an email, your organization has been added, this is free, there's nothing you have to do, just like disseminate. And we had a few organizations that would email us back and say, oh, please do not, because we do not have the capacity to receive more people. So we cannot have more participants. We are a very small program. We have 15 spots only, and we already have a gigantic waiting list. Do not advertise us. So that's a real problem I found. So other organizations like the YMCA is a good example that they have capacity, they have the infrastructure, but then there is no space, or at least we hadn't managed to get into a space where we can really collaborate, because they are working on their own thing, right? Like everybody's working on their own thing, and that's all the capacity that they are using. So they're happy to be part of it. They're happy to have a sticker like we send dissemination materials and to say like we are on Jouer, nice. But more than that, it seems that nobody has the capacity or the investment, I don't know, to do. But I would love to. I keep trying to poke people to see if anyone has a better business idea or business development idea, please talk to me. I'll be happy to have this conversation.
So Keiko, it's a real good opportunity for social entrepreneurship. So people that have business skills that, are not necessarily trying to have the biggest return on investment and so forth, but who really want to contribute in some way, it's a good opportunity for them. Our next questioner.
Hi, thanks very much for your presentation and the work that you're doing. I had a couple semi-quick questions. I was wondering, in your data collection, if you disaggregate by types of disabilities and and you feed that back to communities that are working with those particular populations. And similarly, as you've been getting into the wonderful world of HRC and shadow reporting and whatnot, in some cases, the disabilities community can sometimes be, like all society, fragmented and have its own competitions and things. And I'm just curious how the Canadian disability communities, plural, how well they're collaborating in this way, or if you're finding challenges, or how you're trying to overcome them.
Excellent questions. Yeah. So for your first question on disaggregated data, yes, we do have. So when people sign up for the app, if you download and see, like you see there is an option to identify. It's optional, it's not mandatory, but most people do identify like what type of disability they have, or so there are two layers, right? So one, what type of users they are, if a person with disability, parent, educator, or healthcare, or researcher, or other. But most of our users, half of our users are parents, and the other half are professionals, either education or health. So we do ask for parents what type of disability their child have. So in the app data, if that's what we're asking, we do have this differentiation, but most of our actual users are parents, right? Are not the person with a disability. We are doing right now an implementation project to grow the youth use of the app, and we are building in gamification features into the app, so to have more youth using the app. So maybe this will change our demographics, but we do collect that disaggregated by disability type. So that's for the first question. For the second, on fragmentation of disability groups, that's definitely a reality. In Canada, it has been, because it's kind of recent, right? So we're now going in 2025, we're going to the second reporting in Geneva. So the group has the group of civil society organizations is kind of growing, trying to grow into a harmony for the parallel report. So for example, I think it's a big victory, and even comparing the Convention on the Rights of Children and the disability, the Children's Convention group is very fragmented, and every organization produces their own shadow report. So every reporting cycle, we have like 150 shadow reports, and we know, right, that there's only so much the committees read. So it's a very fragmented message here. On the disability community, we are still being able, so we did for the first and we're doing the same for the second, a very, very amazingly so organized shadow report, only one report, where we conveyed all the civil society organizations to produce one report. So people, we have a distributed leadership. So I lead Article 7, someone else leads it. Organizations and voluntarily say, I want to lead this article. And then whoever wants to join, we are responsible for joining and putting one big report together. So I think this is positive. But so that's for the reporting process, but for the monitoring process, it's a bit more touchy. So that we have the Canadian Human Rights Commission is responsible for monitoring, but they are very much, or not necessarily, I have to say who's in the room to, if I can say it out loud. But so there are some issues, let's say, between the Canadian Human Rights Commission and the civil society organization. So there is a bit of attention there, and funding and whatnot. So the government funds both processes, right, to be independent enough, but it's not very, so the monitoring and the reporting are still not in harmony as they could and should, which would increase the potential, but it's at least not as fragmented as in other groups.
Okay, I think we have time maybe for one more question. I don't see one, so I'm going to take advantage. So Keiko, you have also been kind of at the forefront of doing what's called KT, knowledge translation. And you saw on her slide a couple of examples of this knowledge translation. And it goes back to your question as well, is how do policymakers and so forth take advantage of these different programs and so forth? So Keiko, can you say a little bit about how you have approached knowledge translation and some of the successes, I guess, or strategies of really making sure that other people can take advantage of these strategies?
Yeah, and that, yeah, sorry, I realized I didn't answer that part of the question for how do we feed back the data, the disaggregated data, not for the communities. So a lot of our strategies are centered into those constructive dialogues strategies. So a big part of our knowledge translation strategies are on constructive dialogues. For each, so we have a regular ongoing relationships, and that's what I tell my students most. If you want to invest on one thing, if you want to do research with communities, is invest in the relationships. So we have those constructive dialogues with a certain frequency, and depending on specific issues, where we do go and feed all the research data that we've collected, but we also ask the communities what specific data they want. So one example is we did in British Columbia, we did a leisure-centered adaptive leisure policy constructive dialogue, where we had those organizations, so the key organizations promoting leisure. We had government officials, the Child Health BC, Ministry of Health, Ministry of Children and Families, and we brought everybody together in a full day kind of symposium. That's why we call it constructive dialogue. In this, we present a snapshot of research, of the general research that we're doing in that pertains to the field. Then in the second part, we had done previous to the meeting, we do what do you call a realist review. So we ask those organizations, what are the key issues that they are facing in the province? So that is a key aspect in knowledge translation to policy, especially, is being able to adapt to the local context, right? So adapt to the research information to the local context. So we conducted this realist review based on topics that the community organizations raised. So for example, they said, we don't know how to train staff for inclusive leisure programs, right? So usually we have summer students or monitors that come, and then people go, and if we don't have a way to maintain the capacity that we build. And we did a literature review on that, and we see what's some research ways of maintaining capacity, maintaining continuity of in staff and service provision. We do the realist review has this context outcomes related. So what the context matter, what outcomes you could expect. And then we had this dialogue where we presented the research and we had everybody discussing and saying, okay, what does that do to you? What does it mean to you? And this space has been very, very constructive, because that's an opportunity that organizations, even in the local province, have not talked before about that. So in this meeting was a great example, like in BC, because one organization found that the government had a program to fund exactly the capacity building that they needed, and they talked, and then things happened that are out of our research realm, but that are happening in real communities. We've done a bunch of those, so that's one big strategy. The constructive dialogues, I think they work really well because they allow for dialogue. The other strategy that we do is generate those infographics, like the one I showed for the convention, and training workshop for families. So we have the SPORE network, which is similar to what you have in the States. It's the Picori network. I don't know if you're involved, but so it's the patient-oriented, and I'm saying patient because it's not in the health space, but we really have families, like parents, youth with disabilities, as part of the research teams. And they are the ones telling us, like, oh, this is what families don't know about. So families, other parents don't know that they can make a human rights complaint and file a court case to have their children participating in the soccer camp, right? So you could do that, like, so teaching parents and families how to use those instruments as advocacy, as awareness raising. That is the other thing that in terms of knowledge translation that has been really strong. And then working directly with government, so having a seat on the table, that's really literally what it is, on the main discussion. So I am on the technical committee for the standards development for the Accessible Canada Act. I'm sitting on the Quebec provincial ministry on their developing the accessibility plan. So having, and in any opportunity I can, I bring my data, I bring the information that I have, and I think that's the way to do knowledge translation that can potentially impact.
I think everybody can see why Keiko and I get along so well. So thank you, Keiko.
Can talk a lot.
Absolutely, absolutely. All right, so we're going to take go right into it. I'll take a 5-minute break. We'll do a quick transition. Keiko, the robot is ready for you if you want to try to log in. I did resend the logistics, so you can do that. And then we'll have our last presentation on Brendan's approach, the Brendan sailing approach. So thank you, Keiko.
Okay, thank you very much. Thank you all.
You're welcome.